This is an x-ray of my client Kelly with a moderate scoliosis, and she tells me that they've measured a 43-degree angle recently. And today we experimented with modifying the seating surface on the left side. We raised the left side by about 3/8 of an inch. And then we placed a 1/2 inch, I'll call it a lift, but it's on the back of the left side of her pelvis. And we put that into these seat and back cushions that she uses. And I'll show you what those look like. They're very easy to make. And everybody's scoliosis is different, so it does take some experimentation. But sitting on magazines is a good beginning point. And placing magazines on the back of each side of the hemipelvis is a good way to experiment to see if you need these. The materials are inexpensive. We're using craft foam that you can buy at any craft outlet, and also cork, 1/4 inch cork, that you can buy at any craft outlet or any hardware store. So your thoughts, Kelly, what does this do to you in sitting?
Well, it definitely makes me feel like I'm sitting evenly and more kind of upright. Typically, when I sit without any support, I'll feel like I'm going over to the left, which is going into my scoliosis curve, and even my hips kind of feel like I'm putting more pressure on the left. But right now I feel quite even and upright.
Good. And how about front to back?
Front to back?
Yeah.
Yeah, I feel more center, more even. It looks like, to me, my legs are more even. It doesn't look like one is higher than the other. And overall, it just kind of feels very centered.
Very good. So you feel like you would have more long-term sitting comfort with these devices?
Yes. Sometimes when I would veer over to the left, I would get my pelvic floor symptoms a little bit more activated.
Very good.
Yeah.
So it's a simple solution. And so what we're doing by using a lift under your left sit bone and a spacer behind your left ilium, left hemipelvis, we're matching the shape of your pelvis, the way that the scoliosis altered the shape of your pelvis. So you're sitting with the scoliosis supported, with the shape of the pelvis supported the way it is, rather than a symmetrical seating surface trying to force you into a false symmetry. So we're sort of matching the way the pelvis is when you're standing. I hope that makes sense. And what I'll do is I'll bring those devices over here and I'll show you the inserts that we made for them. So bear with me just a second. And so she uses a seat cushion. And so that made it very, very convenient, because all we had to do is cut 2 pieces of foam. And so this is 6" by 12". There's a piece of, that's either 2 or 3 millimeter craft foam, the black, and then 1/4 inch foam, and we just used duct tape on the outside, and so it wouldn't fray. And so we put that under the left side of her ischium. And we did a similar thing on the backrest. And it took a little bit of experimentation, but it was pretty easy, actually, with magazines. And this is a double piece of foam, 6" by 12", and it's on the left side of her back cushion. And you can be creative. You don't necessarily have to have a seat cushion or a back cushion to make these changes. Again, a little bit of experimentation will go a long way. I'm not aware of anyone else doing this, and I'll be happy if I hear that there are others, and it would be nice if there was a kit available. But there is no such thing, so it just takes some good old-fashioned ingenuity, and I hope that this is helpful to you. Thanks.